Hi, and welcome to And So Much More. My name is Cami Smith, and I am your host, and I am here with James Bryant, and we are in the Lynchburg General Hospital. We're in the ER, but we're in a very new space in the ER. This is the emPATH unit, and it is finished. Grand opening is coming. When some of you watch this, the grand opening may have happened, but we want to give you a chance to have like an inside peek and to learn what is at the heart of this unit, because it's incredible. I'm gonna let James tell you what's incredible about it, because he'll do a much better job than I will. But let's go ahead and talk about like, what is this space?
So emPATH was a concept started by Dr. Scott Zeller in 2016. He developed the first one in Alameda, California. And so we were looking for a concept. We had a very generous donation through the Centra Foundation. And that got us to thinking, what could we do better as an emergency department and for our behavioral health patients? And so we came up with this concept, emPATH, which is for Emergency Psychiatric Assessment, Treatment, and most importantly, healing space. So what we want to do is heal people and avoid the trauma of going to a hospital. And so what emPATH does is bring people in and treat them in a very unique concept. Very different from our current emergency department, where patients are put into a single room, oftentimes with a sitter or a camera watching them for safety, without a lot of interaction, without a lot of programming and things to help them get better. So we wanted to change the way we do it. So when patients come in, oftentimes they're accompanied by law enforcement, and so they'll come in through a private entrance to protect that privacy and to give them some space, and we'll place them in an intake space. And so intake is really an area where we can just check them, help them get into some clothing that's a little bit safer, and make sure they don't have any contraband like needles or weapons, those type of things.
Well, let's head in and check this out. So this is going to be like your normally expected intake space.
And then they'll go into the emergency department for a brief medical exam, just to make sure that they're not a diabetic or they don't have an electrolyte imbalance, which may be causing some of their behavioral issues. So we do that very quickly, and then the patients transition here to emPATH.
Once they've gone through the intake process, we head down this hallway, and we're headed to the larger space, which is going to be basically the space for your incoming patients.
Correct.
And so is someone always accompanied as they're headed down this area?
They are, so patients are never left alone, and that's so that they can also explain what the concept is. This is the space you're going to, this is what to expect when you go through the door, that it's an open area. That's going to be very different for our patients who've been used to going to a private space. Now they're going into an area where they're joined by other patients having similar issues.
Okay. So here is our entrance, emPATH unit. Now typically someone would ring the bell to go in, but you're gonna go ahead and let us in. But tell me about this wide, this is a huge door. Why is this door so enormous?
So one is to help people get in and out quickly, but if patients did need some help, so patients can have issues like a seizure maybe because of some of their psychiatric medications, or maybe there was an undiscovered medical condition. We can quickly bring a stretcher from the emergency department, take that patient back.
And it would fit through this big wide door.
Easily.
Perfect.
So the first space we get to is really a consult room, and that's where we can take patients for a private conversation. So it is badge access for security for our patients and staff. And it's a large open area. You'll notice there's a huge television on the wall. That also has a number of cameras, and we have a speaker, because some of our patients are actually undergoing, legal proceedings, and so they can be part of a commitment process or have a hearing to determine whether or not they have capacity or what steps they needed for treatment. And so having this allows them to have that private conversation in here versus an iPad.
Okay.
And it's also a place where we can meet with families. Our patients can actually have visitors. So when visitors come in, because this is a shared space that we're going to, this is an area where they can have a private conversation with family or friends.
Okay. All right. Well, I'm going to follow you.
Okay. So the next room we get to is really an open space, but it's where patients can just, if they're having a bad moment, so for whatever reason they just feel overwhelmed, they need to be compressed for a moment, they can go into this reflection space. And coming soon are a set of magnetic doors. So the magnetic doors will allow them to get a little bit of isolation, but we're always in view of our staff so that they can take and intervene if they need some support. They can take a quick nap, they can rock in the rocking chair. We have mats to do yoga or Pilates, so those type of things they can do in that space and just kind of get away for a moment.
And so we're into the larger, more like common room. So this is where you're interacting with other patients. Can family come in here?
We try to avoid having family because there are other patients. So, we want to try to protect that privacy. So that's why we have the individual room up front so they could do that. But the other thing that's really unique about the space, you'll notice there's no walls. People can interact. There's nothing that restricts people. If I need to go to the restroom, I come to the restroom. But we do take and ask that our patients allow us to let them in. And that, again, is just for their safety so that we don't walk in on someone inadvertently. And you'll notice that the restrooms are very, very large. I wish I had this restroom in my own home.
Yes.
You can actually get the entire room wet, so there's no way really to flood the space. But it's also got very unique features. So the fixtures that are in there are all ligature resistant. So, what we always worry about with patients anytime they have things like towels or sheets or clothing is they could potentially harm themselves. Everything in there has been designed to reduce that risk. So they can be in there by themselves and not have to be watched while they're doing, intimate care.
Dignity, privacy, yes. It goes a long way. So this is a communal space. Obviously, we got televisions here for probably calm sources of entertainment. What about like these cabinets? Is this just supply area here? Personal belongings maybe?
No, for all of their towels and shampoos and all the things to help them with their bath time. And then also they can dispose of their towels. Here, we really want to encourage patients to take care of themselves.
Yes.
This is an area where we want you to get better, but you also are getting better with a group of friends.
Yeah.
So that's, I think, the important part of emPATH. But the televisions can be used for entertainment. We can show movies, or we can do education. We can play games, art supplies. But what's different about emPATH versus the emergency department is most of our patients were just waiting. And in the emergency department, waiting is wasted time. So we want to take away that wasted time. So now we actually have programming. So patients will develop their own safety plan. What's going to happen when I get out of the emergency department? What are my plans for discharge? Maybe I need some education on substance abuse, or maybe I need help finding a car so I can get to work.
Yeah.
We've got social workers who will come in and help with that. And then working with Governor Youngkin's Right Place, Right Now program for psychiatric care, we have individual care plans we can share. We can also connect them to what they call a high utilizer group, so people who frequent the emergency department can be connected with a peer-to-peer support specialist after they leave.
Yeah.
So we kind of continue their care beyond the emergency room. So that's what we really want to do for this.
Wonderful.
So I do want to highlight one of the things. We had an incredible designer, Wimborne Coleman, who has been working with us on this with all of these beautiful colors to make it a kind of a calming space. But one of the things that we did not really appreciate, or at least I did not until it was put in, was this mural, which was done by a local artist. And it just, it's striking visually, but it also is calming. It kind of puts you in the mood that, it's a place that I'm safe and I'm feeling good about myself. And that's what we want. We want people to feel good about themselves in the space. And you'll notice that this part of the desk is open. That's because we want staff. Staff will be out here working with all of our patients, mental health technicians, registered nurses, advanced practice providers for psychiatry, our psychiatrists, medical doctors when necessary. So all of these folks are working here together. Now, of course, we can always take you back if you need some privacy, but we really want to know our patients to understand that we're in this together. Yeah. We're here to help them, and their fellow patients are here to help them get better.
Yeah, and so all of this furniture is on wheels, I'm noticing. What is the purpose of that?
So it's really so people can group together. So maybe there's a group of friends who get together and they can kind of pull their chairs closer together. Or maybe I'm not feeling particularly social that day and I can kind of pull myself back a little bit. Here. But the staff can see that and identify who needs that extra help. Why are you kind of pulling away from the group today? Yeah. What can we do to help you feel better? So it's really an opportunity for us to visualize our patients in the real world.
Yes.
How are they interacting? What's giving them their anxiety? What's creating their issues? And help them work through that in a safe space so they can be successful. One of the things that Dr. Zeller, when he created the model, he said that you can never put all these patients together. They'll fight. That's not what he found. He found that actually this promoted more conversations, more healing, and that he used restraints and other devices much less than in traditional psychiatric facilities.
Wow.
So that's what we're hoping to see here too is,
Yes.
you know, people are on their best behavior oftentimes when they're with friends.
Yeah.
So we want them to learn, again,
Yeah.
to do that, to mimic what they see in the real world.
Yes. Well, and they're sitting in this beautiful space with calming colors and the calming atmosphere, and that's got to be reflected in their blood pressure and maybe their like fight or flight response. Those things are just kind of brought down into a safe place. So, so let's swing around and talk about what we're seeing over here.
Okay.
So this is kind of, look, to me, I would call it the control room, but what would you call this space right here?
So you'll notice this area does have some glass, and what we discovered when we were looking at the plans is, you know, patients will actually sleep in this space. So most of our patients are expected, you know, to be in and out in about 24 to 36 hours. So we didn't want everyone to have a bed, but we wanted them to be comfortable. So the lights will come down at night, there'll be some soothing
So it's
music.
stimulating.
Mhm.
That's incredible.
And we have masks and earplugs if necessary, but it's just a place to rest and,
Yeah.
you know, continue your journey. But our goal is to get people out and home. And Dr. Zeller's study, 60% of his patients were able to go home within 24 hours.
Wow.
So it's really about stabilizing medications, getting
Mhm.
people into therapy, and then connecting them to, you know, local resources like Horizons Behavioral Health, Crossroads in Southside, and of course the Danville, Pittsylvania County Community Services Board.
Okay.
So having those connections back to those community resources is key.
Yeah.
And so we want to have those lines of communications open. So we have social workers and, you know, people who can really help with those connections. The other thing that's important about Zeller's model that we really like is we don't want people to ask for things. You know, these are not children, these are adults.
Yes.
And so we want them to feel comfortable getting something to drink or something to eat or going to the
So
restroom.
that's what all of these cabinets are for.
Right. So during the day, they'll have snacks and things out where they can help themselves. We'll have meals together.
Oh, wow.
So that'll be kind of cool for us. And, you know, again, it's just creating that community.
Yeah.
And so we're really hopeful that that's going to be something that resonates with our patients. The other piece is, you'll notice in here, there's a lot of cameras and things to help us
Yes.
keep people safe. But there's not a lot of things like in traditional emergency departments, it's traditionally one sitter for every one of these patients. That means you have a person watching you
Yeah.
24/7. That's not very healing. It takes away a little bit of that personal space. And so in here, it's much more, you know, you're working on your own. You're having freedoms to choose if you want to work on a puzzle or work on your care plan or get you something to eat or drink, or maybe you need to take a shower, or you can even go outside, which is very unique here. And that actually came from a staff member. He suggested
Really?
it.
So tell me about the outdoor space.
So, you know, part of what all of us can benefit from going outside for a few
Yes.
minutes, even in today's heat, you know, just to get some sunshine. You'll notice this is a very open space with
Yeah.
lots of windows. You know, traditional emergency rooms do not even have windows for the most part.
Yeah.
This place is light filled. We want people to enjoy that. And we also want them to give several opportunities a day to go out and exercise, you know, to play some
Yeah.
games, to interact with people. You know, we're going to have some plants out there, and hopefully one day we'll be able to take and do some planting and stuff
Yeah.
out there. But it's just to give people a change of scenery, you
Okay.
know, and to change it up a little bit. That space too is designed kind of between the emPATH space and the emergency department very purposely, because we can now bring children who are maybe in the emergency department for an extended period of time, or other patients, and give them a safe environment too,
Yeah.
to just get outside for a few minutes, which is really important.
It is. It is. So very quickly, because I want to make sure this is very clear for those who are listening, who is this emPATH unit for?
Mhm.
What types of patients are we talking about?
So these are traditionally for mental health and behavioral health patients, so our psychiatric patients. So you may be having depression, you may be having issues with schizophrenia, you could be having just overwhelming anxiety. And for many of our patients, these are first events. So to put patients in areas that are very psychiatric traditional, which
Yeah.
means, you know, isolated and, you know, kind of, sometimes people can be a little upset and even violent at times who
Yeah.
are experiencing mental health issues. To put all those folks in the same area can be a little frightening and, you know, anxiety producing. This way we kind of segregate those patients to give each group exactly what they need.
Okay.
So there are times when, you know, if you're very, very anxious, you need that isolation, you need
Yeah.
that feeling of security. In this area, oftentimes you just need the thoughts of other people are on your side.
Yeah.
You want to feel that positive energy.
Community.
Yep.
That can come
And so
space.
it's all about that. So it's all about behavioral health.
Okay.
And what's unique about that, Cami, is behavioral health patients spend a lot of time in the emergency department. So the average emergency department visit is around 3 to 4 hours.
Yeah.
Behavioral health can be sometimes days.
Yes.
And so to have them in the emergency department is also slowing down our throughput. And we have a 52-bed emergency department here at Lynchburg General. There are days when we have greater than 20 behavioral health patients, which are all being kept safe. So when you do that, that really has an impact on our ability to see all of our patients. So
And so that those 3 to 4 hour stays become much longer. So this is not for every patient, but it will benefit every patient.
Absolutely.
Okay.
That's a great way to say it.
That's
Because
incredible.
every single patient will benefit from this. And I think what's unique is this is the first emPATH unit in Virginia.
Yeah.
And it's really the only one that I can find on kind of the southeast
Yes.
and right up to New York. And there was a wonderful article in the New Yorker in July, and it was written by a young lady who was really disenfranchised with her chosen profession of psychiatry.
Yeah.
And she said, there's got to be a better way. So she left New York and went to Minnesota. And we actually traveled to Minnesota too to learn more about emPATH. And she was just taken by this and wrote a wonderful article of what you see that's so different.
Yeah.
You know, you see people engaging and asking for help and getting that help. And that's what we want here for our patients. And so since we've started this journey to emPATH, I've been asked to speak. A number of people on our team have been asked to speak about the concept. Our colleagues in South Carolina, they've appropriated $54 million to build 13 of these spaces in
That's
South
incredible.
Carolina. We have colleagues from other hospitals in Virginia who are wanting to see it and can come now that it's completed. But it's a concept, and I think it's taking hold because we've tried so many other things and they've not worked.
Yeah.
And this is showing it works.
Yes, and there's data to back that up and changed lives. So I want to say
Right.
data because that is that is key. But that data is people, and those are lives that are better because of this environment. So you mentioned your team, and this is such an incredible space. It's beautiful. It's calming. It had to have been quite the taking on. So tell me about your team.
So I just want to shout out Shannon Miles and Ishmael Gama, who both work in psychiatry. They've been incredible partners. I've done this for almost 40 years. I've never had partners like them. And when Dr. Matt Foster said, what would you do if you had some additional money? And it was for psychiatry and behavioral health. Shannon and I got together and started doing some research, and Shannon found this emPATH concept, and we just really embraced it. And we actually brought Dr. Zeller here for 2 days. We were fortunate enough to have him here, and he's been following our progress and has been very supportive as we build this unit. And then, of course, Mark Lane, who's been our construction manager, Jamerson Lewis, who's been our construction person. And, you know, this space is filled with safety features.
Oh my goodness, yes. Well, probably more than just the blind eye can see too, because even when I tried to open the door, you're like, that's a safety feature. So they're hidden, they're in plain sight, but it is. It's just such a safe environment.
And of course, Amanda Turner, who's my senior director for emergency service, and Brooke Stratton, who's going to be our manager here, have just done an amazing job. Yesterday, we were in the space actually drilling, you know, what happens if a patient has a medical emergency? What happens if someone kind of has a control issue and they need to be removed from the space? How do we do that safely?
Yeah.
So we've drilled that. There's also safety buttons and features here. Staff in here will wear electronic panic buttons that know their exact location. They can push that button and summon help. It'll say James Bryant. It'll tell them exactly where I'm at, like global positioning satellite. So little things like that make a difference, but it's really to help patients feel safe.
Yeah.
Because if you can't easily hurt yourself, then you probably won't try.
Yeah.
And you'll feel a little bit more safe, a little bit more secure. And who wouldn't feel better in these wonderful colors that Winburn picked out?
Yes.
And you know, and all of our partners that work with us as far as putting in television. You know, it's funny when you see people and they don't understand how it works. You know, like, why are you doing this? Or no, you don't understand. This is created for a special population, and we want to make it safe and we want to make it last.
Yes.
So we're excited.
I think it's going to last. I'm excited for the impact that it's going to have. And thank you for letting us have this sneak peek and this tour in here. I know this is taking a lot of time, but it's good time, and I'm excited for you all to get to see this. And so you'll have to be on the lookout. We're going to have some pictures on our social channels. We'll have this information on our website. You can learn more about emPATH in so many different ways, and we will for sure be having more conversations about it, and you'll have to join us again on And So Much More.
All right. Thank you so much.